Okay, so as was said by Didier Cheche, the idea came from maybe the paucity of data concerning the difference between male and female in trials on aortic valve replacement. So before entering the details of the protocol, it's important to know what is the rationale for the trial and what do we know, what we want to know about this study. So first of all, we know, we will look at the mortality after TAVI by gender. We will first see what we have in the registries. And in the registries, we can see that from three registries, three meta-analyses, in green the men, in red the woman, that at 1 year, mortality is always lower in women than in men. So this is data from a registry. So of course, today there is no randomized trial. We have also data from surgery. On this slide, you see the trends from 2003 to 2014 of surgical mortality at 1 year. You see, of course, it's decreasing over years, but you can observe also that mortality is higher in female than in men. So it's important to analyze, does the benefit of TAVI compared to surgery is higher in women than in men? First of all, this is a quite busy slide, which is a meta-analysis of early trials comparing TAVI and surgery. On the top, you have the woman, on the bottom, you have the men. And you can see that results are quite comparable in men, but there is a significant trend towards better results with TAVI in women from this meta-analysis with early trials. So this is already one important data. If we want to enter in the details of this meta-analysis, we have to, it's not very easy for me, we have to look at the detailed results on the top from the partner trial, on the bottom in the Corval trial. And you can observe then there is a difference between male and female. So male are here, female are here. You see that the benefit of TAVI is superior in women with a 9.2 risk difference for women compared to men where there is a 40% risk difference. And you can observe that in Corval we have the same, and it's even more significant. The risk difference for women is significant, favoring TAVI in comparison to what you can observe in men, where the difference between the two procedures is almost comparable. The results are comparable on these early trials in high-risk population. So the question is the outcome of surgery particularly poor in women, and or is the outcome of TAVI particularly good in women? So we can enter in the details looking at the 2-year mortality, again, in the Partner 1 and Partner 2 trial, so high-risk patients, intermediate risk patients, and comparing men, women, and men. And you can see that surgical mortality is quite, this is in red, is quite comparable between women and men in Partner 1. It's around 32% at 1 year. It's about 16% in Partner 2. So results, of course, have improved because we have intermediate risk population at lower risk. But when you look at the results of TAVI, you can see that in men, they are quite comparable to surgery. At the opposite, in women, results where TAVI are better, and TAVI mortality is lower in women than in the surgical group. So this is an observation coming from the two randomized trial using balloon expandable in low risk and intermediate risk population. Now we can go to the more recent trial, of course, the Partner 3 trial, which again compared surgery to balloon expandable valve in a low-risk population. We had, of course, both women and men, but we have 1/3 of women and 2/3 of men. And here you can observe, of course, that the mortality after TAVI is much lower than before because we have lower risk population, same for surgery. But you can observe here also that the benefit the risk difference is higher in women than in men. Knowing that TAVI outcome is comparable. So you can see that it's quite difficult to make conclusion because the results of the different trials are quite conflicting. And what we can see from the latest trial is that TAVI outcome here is comparable between men and women, and but the benefit is higher for women than for men. So it's most likely, but it's not proven, that the benefit of TAVI compared to surgery is higher in women than in men. So this is a question which is not solved and which remains to be evaluated. And we have to try to understand why, and it's difficult to know exactly what are the reasons for this difference in risk-benefit between men and women. What we can see from this meta-analysis on acute peri-procedural complications of TAVI versus surgery, we can observe that the risk of stroke or the risk of major vascular bleeding is quite comparable, but we have less major bleeding in women favoring TAVI. So we observe at least one difference in this kind of these acute complications. Concerning the other complication we have after TAVI, pacemaker, MI, moderate AR, there is no difference. There is a trend toward less renal insufficiency in women favoring TAVI. But we have different questions which are unsolved. If we go back to surgery, we know also that there is a difference between TAVI and surgery according to the annulus size, because in the early trials, you remember, there was a difference in mortality in small annulus, because we know that the mismatch can be more frequent after surgery than after TAVI in patients with small annulus. So this could explain at that time the differences. We know also, but we don't have the detailed result, that in partner 3 this difference is less because the surgeons did better work to try to adapt the size and to use larger size in women. But still it's a question which remains to be approved. So in summary, it's quite difficult to have a real clear conclusion about the difference between women and men after aortic valve replacement. What we can say that there is probably a reduction in the risk of death for women versus men in patients undergoing TAVI, and there is an increased risk of death for women having surgery. But we know also that there are substantial differences in baseline and procedural characteristics between men and women, which are not eliminated by randomization, meaning that we need a randomized trial to confirm this observation of the higher benefit of TAVI over surgery in women. But also we know that it's something which has been discussed several times, and you can see here that Adelaide, who is not here today, said also recently that we need a randomized trial in this specific category of the population, the women. We know also it's very complicated, and that's why I just want to make fun, show you this slide. I will not enter in the detail, just to say it's very complicated to try to understand why and what are the difference between male and female after aortic replacement, if either percutaneous or surgical, and this emphasizes the need for the randomized trial we will talk about today. Thank you.
So thank you, Hélène.
So.